We begin today with this debate over COVID vaccine booster shots. And today is a big day. In fact, right now, as we speak, an FDA advisory panel is meeting to discuss whether a third vaccine dose is safe or even necessary. Here to walk us through what's expected today and what happens next is Dr. Ashish Jha, Dean of Brown University School of Public Health. Dr. Jha, good morning.
Good morning. Thanks for having me here.
Absolutely. Let's dig in here. This advisory committee is meeting, as I said, as we speak. What's the likelihood of the FDA authorizing a booster shot today, especially with the Biden administration hoping for a rollout starting next week?
Yeah, so we'll see. It's always hard to exactly know what the advisory committee is going to do. They're going to review all the data and have a vote. But I expect that they are going to recommend boosters, that third shot for high-risk individuals, people who are older with chronic disease, immunocompromised. That group is going to get that recommendation. I think the question is, what about young, healthy people? That, I think, is going to be a bit more contentious, and I honestly just don't know where the advisory committee will land on that.
And, there have been some contradicting opinions. If the regular shot loses its effectiveness after 6 to 8 months or so, and there are a lot of people who are anxious to rush out and get the vaccine if it becomes available, if a booster does become available. So is it safe? Should everyone be running out to get one when the time comes?
Yeah, so I think two things are really important here. First of all, even 6 to 8 months later, you do start seeing more breakthrough infections, but protection against hospitalizations and deaths remains very, very high. So nobody should feel any sense of panic that their vaccines aren't working anymore. But for high-risk people, it does make sense. And for everybody else, I would say, hold on, see where the data goes. But we are not at any point where people who are young and healthy need to go out and get this. Let's see what the FDA says, and then we're going to have more data in the days and weeks ahead.
Dr. Jha, as you know, the CEO of Pfizer said earlier this week that the company plans to release their COVID vaccine trial data for children ages 6 months to 5 years old as early as the end of October, pending emergency use authorization. The most realistic timeline for when kids under 12 can get the shot, that's the first part of my question, Dr. Jha. And the second question, is that going to get us out of this pandemic once you start getting millions of children vaccinated?
Yeah, so to your second question first, I think it's going to help a lot. I mean, getting kids under 12 vaccinated is going to make a big difference because there are a lot of people, a lot of kids, right? And even if half or 2/3 of them get vaccinated, it will make a really big difference. So I am looking forward to that. In terms of timeline, 5 to 11, I think that group, we should see the first shot if everything goes well and the science is good. Probably around Halloween, we may see that first shot going in 5 to 11-year-olds. A month later for kids under 5, certainly by the end of the year, all of those kids should be able to get their first shot.
That time could be here before we know it,
Yep.
so good information. Dr. Jha, as always, thank you for your time this morning.
Thank you.
Hey, thanks for watching our YouTube channel. Find your favorite recipes, celebrity interviews, uplifting stories, shop our favorite deals, and so much more with the Today app. Download it now.